As more and more Omicron cases are reported globally every day, it is only a matter of time before the variant emerges in our community. That is the message today from Singapore's COVID-19 task force, which also gave a numbers update. As of today, a total of 16 Omicron cases have been detected here, with 14 imported cases and 2 local cases who are airport passenger service staff. All are fully vaccinated with no or mild symptoms. 13 cases are recovering in isolation wards at the National Centre for Infectious Diseases and 3 cases have been discharged.
There is a potentially big Omicron wave coming our way and we need to get prepared. The question is, what kind of transmission wave is Omicron? Data from overseas suggests that it will be more transmissible than Delta, so we may be looking at a large wave. But there are also indications that Omicron infections may be milder. We have ridden through a big Delta wave together, we have built up our defenses, and we have gotten life somewhat back to normal. So I don't think we would want to give all that up and go back to where we were last year before Omicron. Second consideration is that it is actually not realistic to stop Omicron from coming into our small city-state.
The task force also announcing updates to vaccination differentiated safe management measures to better protect the vulnerable and at-risk groups. From January 1st next year, all recovered COVID-19 patients who are not fully vaccinated will only be given 180 days of exemption after infection to enter settings with VDS. This is down from the current exemption period of 270 days. And from February 1st next year, VDS measures will also be expanded to cover more settings, including all indoor sports facilities, institutes of higher learning and leisure guests in hotels, hostels, as well as service apartments. Additionally, from February 1st as well, all events, irrespective of event size, must implement VDS in order to proceed.
With these series of measures, we are effectively enhancing and strengthening our VDS measures. And that means that across a whole range of different settings, whether it's activities, events, indoor premises, workplaces, there will be more restrictions on unvaccinated persons. Because unvaccinated persons are at risk, should they get infected, there will be severe consequences and we have to protect them. I've described some of the additional measures we are putting in place to prepare for the Omicron variant, but at the end of the day, personal responsibility remains crucial. So please stay disciplined, cooperate fully with all the SMMs, and get into the habit of self-testing regularly.
Now, given the higher transmissibility of the Omicron variant, the Health Ministry is putting in place contingency plans to ramp up capacities at ICUs, public hospitals and COVID-19 treatment facilities. Those infected with Omicron will also be included in the home recovery program. More than 300,000 children aged 5 to 11 will progressively be able to book their COVID-19 vaccination appointments from next week if the delivery of pediatric doses of the Pfizer vaccine arrives as scheduled. As Senior Minister of State for Health Janil Puthucheary explains, the benefits of vaccination far outweigh the risks of getting infected.
Vaccination is safer than getting a COVID-19 infection. COVID-19 does tend to be milder in children compared with adults, and severe disease is uncommon. But there is still a risk of children developing severe disease, with some cases requiring hospitalization, oxygen supplementation, and ICU admission. We're seeing about 1 or 2 cases of multi-system inflammatory syndrome in children, MISC, about 1 to 2 cases every week since mid-October 2021, and some of these children have required ICU care. Getting our children aged 5 years and older to receive the COVID-19 vaccination will help protect our children from getting the COVID-19 infection and keep them from getting seriously sick even if they do get COVID-19. So, reducing the risk of severe complications such as MISC.
We have a lot to discuss with Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health. Welcome back to the show, Professor. Professor, the overall message today seems to be that it's not realistic to stop Omicron from surfacing in the community, and Singapore is getting ready for it. Your thoughts on today's announcements?
Thank you for having me back. I think it is certainly not realistic to expect Singapore to be able to keep out the Omicron variant from entering Singapore and from spreading in the community. All we have to do is just look at what has happened in January of 2020 when COVID-19 first entered Singapore, and then subsequently how the Delta variant entered Singapore earlier this year. And it's not just Singapore. We've seen this pretty much happen in almost every country in the world, and how the Delta variant is now responsible for the vast majority of infections in many countries. This is the nature of an interconnected world where international travel and trade is so common these days that what happens in one country will eventually spread to other countries. The only way to stop the Omicron variant from entering Singapore is to completely shut our borders to all travelers. And we all know that this is never going to be possible or realistic. And if we cannot do that, then we must think about ways to ensure we slow down the process of the variant coming into Singapore. And if it does come into Singapore, how do we minimize the chance of it circulating freely in the community? And this is where the stepped up testing, the contact tracing, and the quarantining of exposed contacts come in. And this is exactly why in today's announcement, it highlighted the need to maintain our surveillance through the mandatory rostered routine testing for frontline workers to quickly detect, as well as stepping up the vaccine differentiated measures, our booster vaccination program to protect. So you'll notice that a different suite of measures were announced today to detect quickly and to protect better.
Professor, with kids between 5 and 11 years old being the next group to get vaccinated, help us understand to what extent will it help in preventing a new wave of infections and of course community spread as well?
By now, it should be clear that children are susceptible to be infected with COVID-19 as well. And a small percentage of these children will go on to develop symptoms and experience severe infections. So there is potential harm for children when they're infected. Vaccination is meant to protect someone from the harmful effects of an infection, and we now have data that shows the vaccines are effective in protecting children as well. And because of that, we should move on to the next step of vaccinating children. Now, regardless of age, whenever one is infected with COVID-19, there is a risk of spreading the coronavirus to others. And we've seen clusters emerge in schools, in tuition centers. So by extending the vaccination to children, we reduce the possibility that clusters will happen amongst children. Now, I think it's important to be clear. A vaccinated child could still be infected, but we know that the risk of severe symptoms is much lower for one that is vaccinated compared to a child that isn't vaccinated. And this is going to be important as we start to open up Singapore in even greater measures. Especially now we know we have the pediatric doses or the kid-sized version of the vaccine that can be given to children. This is to protect children against the worst of a COVID-19 infection.
Professor, the task force also announced that from January 1st next year, up to 50% of those able to work from home will be allowed back in the office. Now, we talk about, Singapore is bracing for an Omicron wave. Is this a sensible move?
But to be honest, this is always going to be an experiment, just like how we had the different phases of relaxation previously, where we relaxed the COVID-19 restrictions in different phases. No one knows for sure whether allowing some people to return to work, up to 50% to return to work, will not cause a huge spike again. But I think one thing is very clear. We do need to return to some degree of pre-COVID normalcy, perhaps gradually. And this means we need to take the steps to ease back into routine. And I think it's important to highlight that over here today, the announcement is not all 100% of the workforce is allowed to return to work in the office, but only up to 50%. And at the same time, we also announced a number of different measures that differentiate between those who are vaccinated and unvaccinated. And essentially, the way I see it, we are allowing mostly those that are vaccinated to return to the office. And at this point, we do have to consider all the measures in totality. We have expanded the vaccine booster program to all those who are 18 years old and above. We've increased the number of quick test centers for people to test themselves rapidly to identify whether they're infected or not. We've increased, or we are in a process of increasing our hospital capacity to care for the very sick when they're infected. And all of these measures are going to be important as Singapore continues on this transition process to treat COVID-19 as an endemic infectious disease. Now, if it becomes clear that the Omicron variant is going to cause a big problem for living with endemic COVID, and by big problem here, I mean that even the vaccinated people are now experiencing much higher risk of disease and deaths, then I'd expect that we will need to dial back on these measures, that especially when we start to see the evidence emerging overseas, particularly from the United Kingdom, where they're experiencing quite a significant Omicron wave at the moment. Once we see that Omicron is indeed more dangerous than we think, I'm pretty sure we will return to some of this, we will dial back some of these measures. But I think it's important to mention that until then, we should not live in a continual state of fear, and we should make plans to gradually and carefully return to normal. And that's where I see today's announcement to essentially highlight these plans, that we are continuing our plans to return to normal, but to do so carefully and prudently, while making sure we continue to have the capability to detect quickly and to protect the people.
Prof. Teo, always thank you for your insights. Professor Teo Yik Ying, Dean of the Swee School of Public Health at NUS.